Welcome to Penrose Learning, where we make understanding easy.
You start by preparing the device and skin so the procedure is effective and safe. Clean the roller and your hands with 70% alcohol and wash the area with a gentle cleanser. Once done, pat dry. Make sure numbing cream is applied only if you were instructed and avoid retinoids for 72 hours. Next, choose a needle length between 0, 5 and 1, 0 millimeters for most facial zones. This balances penetration and healing while minimizing trauma. You now perform the controlled rolling movements to create uniform microchannels. Divide the area into sections and roll each section with 4 to 6 passes per direction, vertical, horizontal, then diagonal, to ensure even coverage. Use light, consistent pressure. You should feel resistance but not sharp pain, and stop if you see pinpoint bleeding. Once a section is complete, make sure to move methodically to the next to avoid overworking any zone, and maintain a steady rhythm for consistent results. You finish by protecting the microchannels and promoting repair. Gently apply a sterile, hydrating serum or barrier balm and avoid makeup for at least 24 hours. Once skin begins to recover, use sunscreen SPF 30 or higher and limit sun exposure for 48 hours. If you notice persistent redness, swelling beyond expected, or prolonged bleeding, stop using the roller and consult a professional. This could signal infection or too deep penetration. One troubleshooting tip: if irritation occurs,
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.